Right, exam time. You need to know the ins and outs of healthcare waste management, and you need it to be clear and simple. Well, you've come to the right place. We are going to nail down everything a UK dentist has to know. Think of this as your high-speed revision session. Let's get straight into it.
So, let's kick things off with a question that you will almost certainly see in some form. It's the absolute core of this whole topic. What is your legal duty of care for the waste you produce? Get your head around this, and everything else we talk about will just click into place.
Here's our game plan. First, we'll properly define that duty of care. Then, we'll dive into the big one, classifying your waste. Honestly, this is where the real marks are, so pay close attention. After that, we'll get into the paper trail, proving you did everything right. And we'll finish up by looking at the practical systems you need to have in place for a safe practice. Let's go.
Okay, Section 1, your duty of care. This is the legal principle that everything else is built on. Basically, it means that any waste your practice creates is your responsibility, from the second it's made right up until its final safe disposal. You can't just pass it on and wash your hands of it. It's on you.
So what does that actually mean day to day? Well, it boils down to this. You've got to sort your waste properly and store it safely. You have to package it up correctly for transport, describe it perfectly on all the paperwork, and this one's a biggie, you can only, and I mean only, hand it over to someone who is officially authorized to take it.
All right, on to the most important part for your exam. This is the real meat of it, classifying all the different types of waste. You've got to know the categories, the containers, the codes, and what happens to it all. Getting this stuff right is absolutely non-negotiable, so let's break it down.
First up, sharps and pharmaceutical waste. This stuff is hazardous. Your number one visual clue? The yellow lid. See a yellow-lidded sharp spin, and you know exactly what's inside. We're talking needles, scalpels, even teeth without amalgam fillings. And here's the crucial disposal fact. It is incineration only, no other option. Remember that yellow lid.
Next, we have other clinical waste that's infectious. Now listen up, because this is a classic exam trip-up. This is also hazardous, but it goes into orange bags. Not yellow, orange. Think of things like dressings soaked in blood or saliva, contaminated gloves, that kind of stuff. And because it's different, it can be incinerated or go for alternative treatment.
And another color. Now we're talking about medicines like out-of-date local anesthetic. The container for this is a yellow box, and here's the key part, it has a blue lid. So, quick recap. Yellow lids for sharps, orange bags for infectious stuff, and now blue lids for these specific medicines. You've got to know the colors.
Here's a different category, offensive or hygiene waste. This isn't infectious, but it might be, well, unpleasant. Think non-contaminated gowns, paper towels, that sort of thing. The bag for this is the one with yellow and black stripes. People often call it a tiger stripe bag. Because it's non-hazardous, it can go to landfill.
Amalgam waste is a huge one, of course, because of the mercury. The single most important thing to remember here is that the goal is metal recovery. This waste cannot go to landfill or be incinerated. It goes in a special white container, clearly marked with the Hg chemical symbol, and your practice must, by law, have an amalgam separator fitted. And just to round out this section, a couple of others. Gypsum study models go into white containers that are clearly labeled gypsum. Simple. And for X-ray chemicals, there is one absolute unbreakable rule. Fixer and developer solutions must be kept in separate leak-proof containers. Do not ever mix them. Okay, so you've sorted all your waste into the right bins and bags. Fantastic! But how do you prove it? Well, that brings us to the paper trail. This is your evidence, your proof that you're doing your job and fulfilling that duty of care.
This slide right here, this is basically free marks on your exam if you just learn it. There are two main documents. For hazardous waste, it's a consignment note. You need a fresh one for every single collection. For non-hazardous waste, it's a waste transfer note. The key difference you must know, though, is how long you keep them.
Burn this number into your brain. For all your hazardous waste, the consignment notes must be kept for a minimum of 3 years. Not 2, not 1, 3. It's a simple fact and a very easy question to get right.
And for your non-hazardous waste, which is on those waste transfer notes, the period is at least 2 years. So let's lock it in. 3 years for hazardous, 2 years for non-hazardous. Simple as that.
Here's another one of those specific little details that examiners love to ask. On your hazardous waste consignment notes, you need to include something called an SIC code.
For all dental practices, that code is 85.13. Just memorize it. 85.13.
And one last bit of paperwork. The company that ultimately disposes of your hazardous waste has to send you a report back every quarter. It basically confirms what they did with it. It's your job to make sure you get these reports and to keep them for that 3-year period.
All right, we're in the home stretch. We've covered the rules and the paperwork. Now let's talk about the day-to-day systems that make sure everyone in your practice actually follows those rules correctly and safely. This is about making compliance a habit.
Everything starts with a risk assessment. And look, this isn't some dusty document you fill out once and file away. It's a living process. You have to actively look for the risks, figure out how to control them, train your whole team on what to do, and make absolutely sure everyone has the right protective gear and actually uses it.
And that training needs to be for everyone. It's not just about telling staff which bin is which. Everyone who handles waste, from the principal dentist to the trainees to the cleaning staff, needs to understand the risks, the procedures, and critically, what to do if there's a spillage. It's all about keeping the whole team safe.
So, how do you know if your systems are actually working? You audit them. The guidance says you should do a waste audit at least every 2 years. Think of it as a friendly internal inspection. It's your chance to spot any problems before a real inspector does, and it's fantastic evidence that you're actively managing your duty of care.
And finally, just a few hard and fast rules for storage. 1. Waste can't just hang around forever. Nothing should be stored for more than 12 months. 2. Any outdoor storage has to be secure and locked, inaccessible to the public. And 3. Every single hazardous waste container must be clearly labeled with what it is and which practice it came from.
And that's it. That's the core framework. Your duty of care, the classification system, the paper trail, and the daily procedures. But knowing it is one thing. Applying it is another. So, the final question is for you. Based on everything we've just covered, could you walk into your practice tomorrow and confidently audit its waste procedures from top to bottom? Because that's the level you need to be at. Good luck with the exam.